sign up for those night classes that you're on about.
They're reading classes.
What are you doing here? And don't say te reo classes. He's taking adult literacy.
I've got something for you. It's literacy software. I don't want it. I'm trying to make things right. I'm making me feel like an idiot.
Guys, what the... Break it up now! Let him go. You okay? You got it?
Yeah.
You sure? Because if you go him one more time, I will take you out, and you know I can. Okay. All over now, yeah? You realise this is it? Committing a crime while you're on home detention?
No, it was my fault. I started it.
You better come with me.
To where?
To my office for now.
Why?
What?
Why the banana peel gag?
Yes, I don't understand that at all.
What's a classic in it?
The classic what?
Joke. Banana peel on the floor, pie in the face.
You put a pie in his face too?
No, but that's the kind of joke that is old-fashioned, vaudeville stuff.
How is it funny? Dr. Samuels was hurt.
Well, that's where it went wrong. He wasn't meant to.
What was meant to happen?
Well, I was meant to trip on it.
Well, then you would have been hurt.
Pretend hurt.
Pretending to be hurt is funny?
Yes, because I'm making fun of myself.
Why?
Well, to give TK a laugh, to improve our working relationship. You still don't get it, do you?
Well, how does pretending to be hurt improve a working relationship?
Well, it's the context of the Look, never mind, it was a stupid idea and it backfired mega badly. So, what do you got on your slate for the rest of the day?
Surgery. I'm clipping an unruptured cerebral aneurysm.
Ooh, an easy one then.
No, complex. Why did you think it was going to be easy?
So I gave him these help-to-read books in front of another staff member. I wasn't thinking.
Scotty, leave it.
It doesn't justify a fight.
I can see now, he was embarrassed. But all I saw was ungrateful. I got angry and I pushed them. It got a bit out of hand.
A bit? I saw more than just a brotherly scuffle.
But that's all it was. Over a stupid misunderstanding.
So you're not going to lay a complaint then?
I might lay a complaint about how a man can spend so many years in prison and not one person helps him learn to read. It's a disgrace.
I know. Hi, Megan. What's going on?
Please, I take full responsibility for this mess. And we'll be fine, won't we?
Of course. And I'm really sorry that I lost it.
I can see you realise how serious this is. The only reason I won't be taking it further is because I'm taking your brother's word he was responsible.
Thank you. I appreciate this.
But you're not off the hook. A nurse here has accused you of stealing.
Not me.
What's that?
Who?
It's private information.
I think I know who. But she's wrong. I haven't lifted anything.
We'll see.
Well, we could check the kitchen, my bag, my locker.
Okay, I'll call security and we'll do just that. What happened?
Sounds like you might have stuffed up again, but worse than that.
What?
I'm an idiot, that's all.
Corticosteroids, oral and inhaled, and its effectiveness in COPD. Okay, sum it up in 50 words.
I'd rather talk about Daniel.
Okay.
Sophie's pretty keen, and she's such a good influence on him.
Yeah, I wouldn't bank on that lasting.
Why?
I just think she's more to him than he's into her.
Well, how do you know that?
It's a guy thing.
Yeah, I know all about that guy thing. Because it's a guy thing not to deal with an issue that really should be dealt with. It's a guy thing to suck it up when you should sort it out. Yes, yes. And I still wish that you would report that banana business.
Oh, news. Sarah.
I just think he needs to be pulled into line.
No.
I'll just go and have a quiet word to Callum.
No, I
I'll
said
just
no.
let him know.
I complained to him about Brooke. Look where that got me.
So Kit gets away with it?
It's my beef, not yours, okay? Leave it.
As long as you promise not to take any more of Kit's crap from now on.
The problem is, I like the guy. If he just stopped micromanaging me...
Then tell him!
I will!
Mum, get off okay? Yeah, she had another I shouldn't leave fit, but I managed to send her packing. Is JJ still asleep?
And did you tell Mum about me and Chris?
I think she has enough to worry about, don't you?
Why would that be a worry?
Because your infatuation has always been one-sided.
Was one-sided.
Look at his track record, Libby.
I'm not blind. I was his PA. I saw them all.
But you're different. What you have is special.
Well, it's early days, so I don't know for sure, but I do know I've always been attracted to him.
And his wallet.
You just can't bear to see me happy, can you?
No, I can't bear to see you hurt. Have you asked why suddenly he is so interested in you?
We can't talk about this now.
Bonjour. Tanya, hi.
Hello. So, you guys off on a date?
Yeah.
Where?
We're going to a French restaurant by the waterfront, L'Assiette. Great reviews.
And quite a change from a panini at the IVA lab. Have fun.
Thanks. So the family are in the loop?
Just Tanya.
And she's thrilled.
I'm sorry. I suppose we'll have to get used to reactions like that.
Why?
Well, you know, PA turned gold digger.
Let them think what they want while we dine at a restaurant where the quail is meant to be fantastic.
Can we do cheap and cheerful instead?
Cheap can be cheerful.
Slow one, eh? Looks like it.
Is it safe?
What do you mean?
No fruit on the floor for me to slip on, or patients, or other staff?
Can I help you, Cindy?
Just here to pick up Mr. Gould for X-ray.
Look, I still feel really bad.
Okay, what happened here?
He fell overnight. Daughter found him.
Temperature 34.7.
Okay, Mr. Fitzgibbons, I'm Dr. T.K. Samuels, one of the doctors here.
Cubicle 1. I'll take it. I mean all yours.
Okay, Mr. Fitzgibbons, can you tell me where you are? You know what day it is?
I think these belong to you.
Thank you.
So I'm guessing the secret's out then, huh?
And I'm guessing you knew, which is why you've been covering for him.
I didn't think it was my place to say anything.
No, and he's so sensitive about it. I learned that the hard way.
So is he going back to jail now, or what's going on?
I'm waiting to find out. As far as I know, he's still with Megan.
Well, if there's anything I can do to help, just let me know.
Thanks.
One more thing. How did the fight start?
Gerald happened to see these. Ty thought Gerald was onto him, that he couldn't read.
Was he onto him?
I don't think so. I did a pretty good cover-up. Well, I thought I did.
But Ty got embarrassed, blamed you, and lashed out?
He's on a hair trigger at the best of times. It was dumb of me to show these around in a public space.
You were so keen to help your brother, you couldn't wait. Hey, does TK know we use Aquacel ribbon now?
Yeah, that'll do the job just as well.
Yeah, but we don't do it that way now. I can tell him if you don't
I'll
want.
leave it. Everything's okay there. Thanks, Tracy.
Hey, have you had any experience with cocaine abuse?
Not personally, no.
I'm waiting on a toxicology report on a patient in Cubicle 3, hypertensive tachycardic seizures. And...
Kip's your man. He knows all about it. We had a patient in a few months ago with similar symptoms.
Oh, it's okay. I'll wait on the report.
Why? He's just over there.
Yeah, I can handle it.
Everything okay?
Yeah, I'm good.
TK.
What's up?
Nothing.
Gee, team spirit we got going on in here is really impressive.
See, who needs to go to a fancy French restaurant when you've got this on your doorstep?
Picked you for many things over the years, Libby, but a cheap date was never one of them.
Oh, no, you've got it all over your new gorgeous shirt.
It's okay.
Here, let me. Oh, I've made it worse.
It's okay. We'll let the dry cleaner handle that. Ease up before it gets cold. it's not so bad. Here, have a drink.
What? No, I can't handle it. I'm going to tell them to turn it down.
They're having a good time. Don't worry about it.
But I want our little picnic to be perfect. All right, come on, off you get. Come on.
What are you doing?
Cheap and Cheerful is cancelled.
Not until I say so. Just relax. Find yourself a nice piece of fish and enjoy yourself. Here. This one is, pretty much sand-free.
So still working here then?
For now.
What'd Megan say?
Oh, she didn't find any stolen goods in my locker or bag, did she?
So she's happy?
Not exactly. She wasn't happy about the fight. Then there's still the the nurse to deal with.
You think you know who that is?
Tracy.
But she's been so good to you.
Was.
No, she was just here. Said she was worried about you.
You're right. Once a cop, always a cop.
Do you want me to have a word with her? Find out?
Nah, I can handle it.
Well, you better get back to it then.
Yeah. Thanks.
For what?
For sticking up for me in front of Megan and trying to take the rep.
It's okay.
Having fun?
Of course. Are you?
Oh, loving it. Oh, sandfly bite? Oh, you poor thing. They're everywhere. You're covered. Oh, and that noise. Kenneth, you're not the only ones on the beach, you know. Did you see that?
Don't worry about it.
Ow! No! I want a French restaurant, and I want it now.
Hallelujah. You might want to...
Shower, head to toe.
I need your input.
Sure.
Quick, take a photo.
I just need to finish up and keep it 2.
I can manage. You two, talk.
What's up?
Vicky Wheeler, cubicle 3, early 30s. Third time this week she's presented with focal seizures. I'm lost for the cause.
How long did they last?
About 3 minutes, localised to the left side of her face and down her left arm.
Any symptoms? Tingling hands, blurred vision, slurred speech?
Nope, and I've ruled out epilepsy, no family history.
Resolving hematoma?
Well, it requires trauma. She hasn't had any.
Recent dental work?
Nope.
Parasitic infection? Has she been overseas recently?
I thought of that too, but she hasn't been out of the country, so I'm left with cerebral metastases.
Cerebellar abscess?
Or a subacute infarction.
Possibly a CT scan, I don't know for sure.
Thank you. I thought as much.
No worries.
Oh, look at you two, practically blood brothers. It warms my heart.
What's this?
It's a way of helping Ty learn to read. What?
Well, it's a nice idea, but don't you think he might find it a little bit babyish?
He was a bit touchy about it at work, but I don't want him to be at home. He needs to know that.
You're right. It's kind and thoughtful.
I hope he thinks so.
So why the turnaround?
Surprise, surprise, he apologized today. He actually thanked me for sticking up for him in front of Megan.
Wow. Big step forward there.
Yeah, so I thought if he can give some ground, why can't I? Hey,
Hi.
how's the rest of your day?
Oh, great. What's this all about?
It's to help you learn to read. I can take them all down if you don't like them. It's no problem, right?
No.
So how does the game work?
What's this say?
Guess it's jug seeing it's on the jug.
Good. What about that one?
Stove.
Good.
Yeah, well done.
I can do some more if you like.
Oh, thanks. That'd be great.
It's too perfect to be tumor bleeder infarction.
Oh, what is it then?
Neurocysticercosis.
Never seen one.
Me neither.
Well, she requires surgery. Do you want me to tell her?
Sure, but gently does it.
Hello, I'm Dr. Jacobs.
You know what's wrong with me?
You have a neurocysticercosis, a pork tapeworm.
A tapeworm? How?
Now all that means is that somewhere along the line you've eaten some pork that wasn't fully cooked.
A tapeworm in it.
Or more likely it's larvae which have attached themselves to your brain.
But there's nothing to worry about, is there, Doctor?
Well, yes, actually, there is. This is why you've been having the seizures.
God, he's sick.
But surgery will remove the cyst quickly and simply.
That's right. I'll be drilling a frontal precoronal burr hole into your skull.
You're drilling my head.
I think that's enough.
Yes, thanks, Doctor. We might do this a bit later.
But it's a very straightforward procedure.
You can't talk to your patients like that.
Patients like facts. That's what I gave
You made
her.
her vomit.
Just let it go.
I know we have to move fast down here, but that's not funny.
Did I make an unintentional bad joke?
No.
Good. So, where exactly was the banana skin placed?
Is she for real?
Oh, Gabrielle, please don't go on
If I
about
could just visualise it specifically, maybe then I'll find the joke funny.
Go! Look, I'm sorry, mate. I just mentioned it to her in passing. I didn't make a thing of it.
Oh, my leg. It's okay, I'm giving you something for the pain. Possible posterior dislocation of the left hip. 5 of morphine, please. Do bloods, group and hold, and organise x-rays.
Onto it. Kip needs a hand.
How's it going out there?
You sorted. You still thinking meningitis?
Yeah, it looks like it. He's going to need an LP. Stats are down to 89% on 8 litres. How about you do it?
I haven't done one since I was a student and this guy is sick.
You'll be fine. You do it. I'll talk you through it.
Okay.
Like I said, team spirit around here is impressive.
Actually, I think I've changed my mind. Can we go somewhere else for a pre-dinner drink?
I thought we weren't hiding anymore.
Kieran and I had a small altercation about me seeing you.
What did he say?
That's not important. I just don't think I can relax around him.
I think you can. You're with me now. That's all that matters.
Evening.
Chris,
Libby. Some bubbly, I think.
you can't see the list?
No, just your most expensive.
Sure. Special occasion, is it?
Yes. It's a Monday.
I think I'm just going to go powder my nose.
Okay, don't be long.
I think you'll like this job.
Good.
Yes. It goes perfectly with the blonde secretary in a midlife crisis.
Well, after the cheap vintage that Libby's been used to, I'm sure she'll notice the difference straight away.
Don't hurt her.
Serve that at the table, will you? Thanks.
What's it say? Cut. You're guessing again. Sound it out.
Mug.
Well done. Did you see I did the bathroom too?
Oh, sure did.
I can do your bedroom tonight if you like.
Sweet.
See you both at work.
Bye. He's only trying to be nice.
I'm not 3 years old.
I know. It's just his way, and it might actually help. Okay, maybe he's gone a little bit overboard.
You'd think. Soap level was wet on my ass before I found it. It's not funny.
Come on, he'll calm down. Is there something else that's bothering you?
No, I think Tracy knocked on me about the stealing.
Yeah, Scotty mentioned that, and, it wasn't her.
How do you know?
Well, I shouldn't even be telling you this, and please, don't take it any further.
What?
Promise me, Ty, I don't want to cause more trouble for anyone.
Okay, promise.
I overheard Carol complaining in the staff room about her stolen wallet and how Megan didn't do anything about it. She even tried to give me a hard time, so...
It wasn't Tracy.
Come home with me.
I can't. I have to work.
Oh, please. Night shift was hell. We could snuggle up, get a DVD.
I'd rather have sex.
I was thinking we could just chill, relax, talk.
Yes. I'd like to talk about my new discovery. I've worked out why the banana joke is funny.
Go on then, let's hear it.
You left the banana skin on the eating floor and TK fell and hurt himself. But people come to hospital to be treated for injuries, not to be injured. It's funny because it's ironic.
Is it? Because so far I'm not laughing. At all.
Tracy. Hey.
Hi.
You got a sec?
Not really. I'm on a short change and I'm cutting it fine.
I'll be quick. I just want to say that I got it wrong.
Which bit?
Well, when I had heard a nurse was complaining that I was stealing, I thought it was you.
Why?
Well, because you accused me of stealing that perfume that I got you. But I was wrong. I know it wasn't you.
No, it wasn't me. I was defending you to Megan, actually, and that was just before I found you headlocking Scotty.
Must look bad.
I felt like a bit of an idiot. There I was assuring Megan what a great guy you were and how you were trying to turn your life around, and there you are beating up on your brother.
Yeah, because he got me all worked up.
Yeah, because he was trying to help you learn to read. That makes a lot of sense.
Well, we made up. We mates again.
Cool.
And I'd like to make it up to you. So, can I take you out for coffee?
Hey, apology accepted, but let's just leave it at that, okay?
How come?
Because I think you have a violent streak, and I just can't be around that sort of thing.
Hang on, do I scare you or something?
No, but that is just the way it is, so take care. Boys' room's that way.
Just listen for a minute, will you?
No, Ty, get out. Go on, move.
You've changed things for me since I got out of jail.
Good, I'm really glad, but there's no need for you to come in.
I didn't even know I wanted to. You made me see that I can change my life around.
Good, but you need to do those things for yourself, not for me.
You can't lose faith in me now.
I'm not.
I'm learning to read because of you. I'm thinking of a future because of you.
Well, you can do those things by yourself as well.
No!
Ty, get out.
Because you're bored now, is that it? Your little do-good at pet projects too hard now?
That is not it.
Prove it!
I don't need to prove anything to you. Yes, I liked you, and yes, I wanted to help you, but I cannot handle the violence. And I don't feel safe around you. This is why. Now, get out of my face before I call security to drag you out.